Hello, today I will be talking about breast and testicular self-examinations. Why are they important? They allow men and women to become familiar with their bodies to easily identify any changes or abnormalities, possibly indicating cancer or other medical issues. If cancer is found, conducting regular self-exams can allow early detection and the best outcomes. Breast. Okay, so just some quick facts about breast cancer. It is extremely common. It is the second leading cause of death in women. About 1 in 8 women will be diagnosed with breast cancer, and unfortunately, 40,000 women die of breast cancer every year. Although rare in men, it does occur. About 2,350 men will be diagnosed with breast cancer, so it is also important for men to do breast self-exams. When should you do breast self-exams and how often? You should do them every month if you are female after your period because the breasts tend to be less tender and less swollen during this time. And obviously, the more familiar you are with your breasts, the more likely you are to detect any abnormalities. But it is important not to do them too often because then it'll be a little harder to detect if anything is wrong. While you are conducting your breast self-exam, it is important to look for any lumps, any dimpling of the skin, a change in the skin color or texture, a change in how your nipple looks, or any fluid that's coming out of the nipple. So a breast exam actually consists of 3 easy steps. The first step is you can do a breast self-exam in the shower. It's easily done in the shower because when your skin is wet, it's a little easier to glide your fingers over your skin. So with a flat palm upon your breast, use your fingers to go around the entire breast and armpit area. The second place you could do a breast self-exam is in front of the mirror. When you do this, it is important to keep in mind that most women have one breast larger than the other, and that is completely normal. That is why it is important to do regular self-exams so that you could be aware of your anatomy. So stand in front of the mirror with both arms at your side and visually examine your breast. Then raise your arms over your head, particularly focusing on one breast at a time. Look for any changes or abnormalities that you're not used to seeing. Lastly, place your palms on your waist and firmly press down, flexing your chest muscles. Once again, make sure to focus on any changes that you may see, including dimpling or puckering or anything abnormal. The third step to performing a breast self-exam is by lying down. This is actually one of the best methods because when you lie down, the breast tissue spreads out evenly. So to do this method, place a pillow under your shoulder on the side of the breast you will be checking. With your opposite flat hand, check your breast and armpit area with your pads of your fingers. Repeat the steps for the other breast. Now we will talk about the testicles. Now some quick facts about testicular cancer. It can develop in males of any age, particularly most common in ages 20 to 34. It's not a very common cancer unlike breast cancer, and it is highly curable if detected early. So men should be conducting testicular self-exams once a month as well, and they're looking for any lumps or abnormalities. And they must be aware of the epididymis, which is a rope-like structure in the middle of the testicles, which is completely normal. And the same, the more you are familiar with your testicles, the more likely you are to detect an abnormality. Performing a testicular self-exam. The best time to do it is during or right after a shower when the skin of the scrotum is relaxed. Step 1. Hold the penis out of the way and focus on examining one testicle at a time. Step 2. Hold testicle between fingers and thumbs and roll gently, looking for lumps, changes in size or shape of testicles.